right, and action. All right, let's go ahead and get started. So we have a couple requests to do dose-response relationships. So we're going to be talking about threshold, non-threshold, and we'll talk about linear and nonlinear responses. So let's go ahead and get started with that. So what we're going to get started with first is, man, I shouldn't have had that pizza. All right, so let's go ahead and draw something here for you guys. So we're going to be talking about dose-response relationships. All right, so dose-response relationships. We actually had a couple requests to do this, so I'll try my best to break it down for you guys. So dose-response relationships, that's exactly what it's talking about. So on the bottom here, let's say we have the dose, and then here are the effects that we can measure. So there's two types of dose-response relationships that we have to focus on. There's other ones and things like that, but today we're going to focus on non-threshold and threshold. So what we have here is we have non-threshold. So keep it simple, you guys. If you see that the corner, this is where the line starts, that means that any amount has the potential to cause harm or cause biological effects. So again, if it starts in the corner, don't make it difficult. Just say, hey, it's starting in the corner, it's non-threshold. That means any minuscule or minimal amount of radiation has the potential to cause harm. All right, so again, if it starts in the corner, it's going to be non-threshold, because that means any amount has the potential to cause harm. So again, non-threshold, we'll say any amount of radiation exposure, I'll just put exposure, has the potential to cause harm. All right, so let's look at how we get this line. So you see how we have a straight line, correct? Now, we know that this is a linear dose response, but what exactly does that mean? Well, what linear means is, as the dose goes up, so let's say the dose is going up, that the rate of biological effects, or in this case, the probability of biological effects are going up at the same rate. So that's what makes it linear. So I'll write over here, as the dose goes up, the potential for biological effects increase at the same rate. So that's how you get this linear dose response. But in this case, we're talking about probability. So we'll say that this is probabilistic effects. So the effects that can occur are going to increase, right? They're going to have the potential to increase if the dose or exposure keeps increasing. But then again, it's probability. It would work out well if the lotto worked that way, right? So if you can go ahead and increase your sales and tickets or purchasing tickets, that would be cool if the lotto increased at the same rate for us to win, but it doesn't work out that way, right? So I don't know what crazy numbers I think you're more likely to get hit by lightning or something like that, you guys, and win the lotto, okay? I keep saying I haven't won the lotto, but I haven't really played, so maybe I should. All right, so let's go back to this now. So the probability of effect occurring is going up at the same rate. That's how they get this number here. Now, if you guys remember a LARA, as low as reasonably achievable, right? It follows this threshold dose response model, the non-threshold linear dose response. Because remember, with the LARA, you're trying to keep dose to a minimum to reduce biological effects, correct? So with this response model, you're trying to say, hey, you know what? If you get exposed to radiation, you should try to keep it down to a minimum, because every amount of exposure that you keep getting, you're increasing the likelihood of the biological effects increasing. But when it comes to non-threshold, we said it's probabilistic, correct? Well, that means that these effects are random. You don't know when they're going to happen. So when we talk about random, we talk about a term called stochastic, all right? So non-threshold are related to stochastic, and if you were to look up the word stochastic, it's taken from the Greek word stocha, which means random. So the biggest random effect that can occur, in fact, it's what all risk factors are measured against, and that's going to be the C word, that's cancer. So cancer is going to be a non-threshold dose response effect. It is probabilistic, and it is stochastic. So cancer, again, is the biggest risk model that they compare it against, all the biological effects. So cancer, they don't know exactly how much radiation caused the cancer in the individual. Heck, they don't even know if that radiation exposure caused cancer because, again, it's random in nature. So cancer, you guys, is going to be stochastic. It's hard to quantify. It's hard to measure. But they do know that the more exposure you get to radiation, the more likelihood of cancer is going to increase. The risk of cancer is going to increase. So cancer is going to be a stochastic effect. But cancer is going to be related to the exposed individual. And this is where we have the term somatic. Somatic, another Greek word, means self, right? So one's body, self, soma. So when you talk about stochastic effects, you know, they can either be somatic or they can be genetic. And genetic is going to occur with your offspring. And this is where you're going to have mutations. You have mutations. All right, so mutations can also be a stochastic, probabilistic effect, but it's going to be occurring in your offspring. And again, that's random. They don't know exactly how much radiation, when it happened, but it caused some type of mutation to occur, and that can occur down the line. All right, so take a look where we're at. We're with non-threshold. And again, you guys, I work off key terms. So non-threshold means any amount or any minuscule, minimal amount of exposure has the potential to cause harm or biological effects. These are known as probabilistic effects. And the biggest effects are going to be cancer and mutations. So cancer, again, was somatic, and mutations are going to be genetic. So they're, again, stochastic. Now think about when these things are going to happen. If somebody were to get cancer, do they have cancer the very next day? No, it takes months and years to develop, correct? So cancer is going to be what's called a late effect. So with stochastic, they're associated with both somatic and genetic, but with both of these, they're going to be associated with late effects. Okay. So stochastic is associated with late effects. They're not going to occur early, they're not acute, they're not prompt, they're not immediate. They're going to happen later on in life. All right, so we'll save this here really quick. We'll come back to it in just a few seconds here, a few minutes actually. We're going to go ahead and go over threshold dose response now. So earlier I made a joke about me having too much pizza. We shouldn't have had that pizza, we should have ate it afterwards. All right, but anyways, I told myself I'm only going to have 2 pieces and I had 3. So my threshold was 2, but I had 3. And now I don't feel too good. I feel kind of full, but it was good pizza. All right, so I had it with jalapenos. But anyways, it was pretty good, so thank you for that idea. All right, so let's take a look at what we're looking at now. So we got threshold. Now notice the line doesn't start in the corner. Keep it simple, you guys. Don't make it complicated. So let's say you have this line not starting in the corner. Let's say you have 1 milligrade, 2 milligrade, 3 milligrade, 4 milligrade. And now all of a sudden you start to have this response that the body is saying, hey, there's something going on here. But notice you have a linear dose response, correct? So from 1 to 3, let's say, 1 to 3, you have an area of no observed effects. Observed effects. So nothing happened during that time. So again, 1 milligrade, 2 milligrade, 3 milligrade, nothing. And then all of a sudden at 4 milligrade, you start to have these observed effects that are starting to be demonstrated. They can be seen by the body. So if you keep increasing the dose, take a look here, you guys. You keep increasing the dose. We try to make sure it's even. And the biological effects are increasing at the same rate. That means it's going to be a threshold response, but it's going to be a linear response because guess what? The dose is increasing and so is the biological effects. So are the biological effects. So again, you have 1, 2, 3, nothing happened. All right. I know this may be a little inappropriate, but I'm going to say it anyways because it's the best analogy. If you have a couple glasses of wine, you have 1 glass of wine, 2 glasses of wine, 3 glasses of wine, nothing, and 4 glasses of wine, now you're on the floor. All right, so that's where you have an observed effect. Again, everyone has a threshold, right? I used to say 1 tequila, 2 tequila, 3 tequila floor, right? Because you're going to end up on the floor. But again, everybody has a threshold. But again, that period between the threshold, that's an area of no observed effects. I don't know if that makes sense. So, threshold dose responses always have an area where you don't really see the observed effects. And then boom, you start to see them. So take a look. This is a threshold linear dose response. And then on this side, again, it's still threshold, but take a look here, you guys. You have this line that's not straight anymore. So now, you guys, this is going to be a curved line. This is an S curve, a sigmoid curve. It's a nonlinear response. So what that means is you still have an area of no observed effects. Let's say 1, 2, 3, and 4. But here, you guys, take a look. You see how it's not straight? So what that means is, as the dose increased, the biological effects did not. You started to have this appearance of effects, but as the dose was going up, it kind of tapered off a little bit, kind of plateaued, and then it spiked. So you have what's called the prodromal, also known as initial stage. Here you have the latent stage, and latent means it's there but you can't see it. All right, and then the last stage we have is the manifest stage. And at the very end, we either have two things, death or recovery. And this is where you have your LD50-30, LD50-60, so your lethal dose. So let's go through these stages really quick. You have the prodromal or initial stage. We have the latent stage, and then we have the manifest stage. And one of the examples I use in class is, let's see with the prodromal stage or initial stage, you start to feel sick a little bit, right? You start to feel a little coarse in your throat, a little congested, maybe a little achy, you don't feel good. And you go ahead and you're like, you know what? I think I just, maybe because I stayed out too late the following night before. You're like, I just need a little rest, need some, NyQuil something. So you go to sleep, take a nap. The next day, you feel better, you feel good. So what you experience so far is the prodromal stage. If you're not feeling well, but now you feel good, right? But then later on that day, a couple hours later, you're like, I don't feel too good. And all of a sudden you have a fever, you have the chills, right? You're achy, right? So now you're full-blown manifest. So you went from the prodromal stage to the latent stage to the manifest stage. So now you're full-blown sick, and guess what? The symptoms are fully manifest. So manifest means you can see them. They're demonstrated. Latent here, the body's trying to figure out if they're getting better, if they're getting worse, if they're trying to recover. That's what's happening in the latent period. It's invisible, but it's there. Then, with radiation exposure, you're either going to have death or recovery. So when it comes to LD50-30, the 50 pertains to the percentage of the population, and the number is related to the days. So if you have a group of 40 people, let's say in a room, half of the population are going to get better if treatment is provided. And remember, you can't treat radiation, the effects of radiation, but you can treat the symptoms. If somebody's dehydrated, you give them, NIV. If somebody is vomiting, you give them antiemetic. If somebody has diarrhea, you give them some for the diarrhea. If somebody's low on blood cell count, you give them a transfusion. So you can treat the symptoms, but you can't treat the sickness itself. So I'm going to go ahead and use this to piggyback on the next thing here, and I'm going to go ahead and introduce you to deterministic effects. So before we were talking about probabilistic effects, correct? Well, with deterministic effects, the severity of the effect is dose related. So they know how much radiation caused that effect. So if we go back to this one here, the threshold, they know how much radiation can cause those biological effects. Think about a depreciation of blood cells in the body. Think about redness of the skin, radiodermatitis, or erythema, right? You can have alopecia, loss of hair. They know how much radiation can cause those biological effects. So those are all threshold, those are all deterministic effects. So going back to this one here, cataracts. For some reason, they like to use cataracts on the test, right? So cataracts is a deterministic effect. It's late, but it's a deterministic effect, but it follows a threshold model that's going to be nonlinear. because the survivors of the atomic bomb, that's where we get the data for the cataracts results. It says that they were exposed to gamma radiation. A certain population of people got cataracts, but then as the dose increased, it kind of plateaued and then it spiked again. And that's where you have cataracts as a threshold nonlinear dose response. Okay, so again, you've seen those test questions for you guys that's in the RAD program, right? So let's go back to this. All right. What happened to deterministic? All right, here we go. So deterministic are related to threshold dose responses. So we have threshold dose responses. So non-threshold was associated with non-stochastic, right? So, I'm sorry, stochastic. Sorry, stochastic is random. So now threshold is going to be related to what we call non-stochastic, or also known as deterministic effects, because they're not random, they're specifically known. With stochastic, the severity effect did not relate to the biological effect, but this one, they know how much radiation can cause that biological effect. So, with deterministic effects, again, they're dose related or dose specific. So, we have, again, erythema, radiodermatitis. We have epilation, also known as alopecia. Epilation is the preferred term and radiodermatitis is the preferred term. We have here blood cell reduction, right? We have temporary sterility. We have ulcerations. We have all these biological effects that can occur, and they're all dose related. They know how much radiation can cause these effects. Now, again, deterministic, severity of the effect is dose related, is a threshold dose response, but guess what? It's going to be somatic only. So remember, we said that stochastic could be genetic or somatic, but when it comes to deterministic, it's going to be the exposed individual only. So this is going to be somatic only. But guess what? Remember, with stochastic, it was only late effects, whereas deterministic, it can either be early or it can be late. So with deterministic threshold dose response, you're going to have either early effects or they're going to be late effects. So if they're early effects, they're going to occur within minutes, hours, days, maybe a few weeks. With late effects, it can take months to years. All right, so I'll write that down. Early effects, they're going to occur within minutes, hours, days, maybe a couple weeks. All right, so early effects are also known as acute, prompt, or immediate effects. They happen right away. I always use the analogy of you playing basketball. If you go for a jump shot, you come down, you roll your ankle, it's swollen, you go to the ER that day, that couple days, that happened right away. That's an acute, right? It's an acute injury. But if you wait and you wait and you wait a few months and then you go to the doctor and says, hey, my ankle's, swollen every once in a while, I got this pain. That's a long term, that's a late effect, that's chronic, all right? So again, late effects are gonna occur for months to years. So, with early effects, we gave you some examples. So, with early effects, erythema, epilation, temporary sterility, ulceration, blood cell reduction, those are all going to be early effects. With late effects, you have cataracts, you have atrophy, right? Atrophy is when you have a shrinkage of the tissue or the object, right? You have fibrosis, okay? So fibrosis is abnormal thickening. So these are going to be late effects, and these occur, you guys, again, at a specific dose, but they occur later on. I remember I used to do MRI for the brachial plexus for patients that had radiation therapy, and they were looking for thickening of the brachial plexus. I remember I asked the doctor, why they put fibrosis as a diagnosis, and then we looked at the clinical history of the patient, and the radiologist told me, oh, they're doing it to check for fibrosis within the brachial plexus. So I said, okay. And again, that's going to be abnormal thickening and hardening of that region. So it can occur anywhere in the body, but again, these are late effects. They're associated with deterministic, but so are early. But again, deterministic is associated with threshold. Let's go back here. Non-threshold is going to be associated with probabilistic effects. Again, the severity effect is not dose related. It's dependent upon the probability. All right, so again, these are random, and we have cancer and mutations. I think the book has cancer and lifespan shortening, which kind of confuses me a little bit, because if you die from cancer, well then yeah, your life has been shortened. But again, you know, the book has it, cancer and lifespan shortening. So I guess you can have leukemia as well, but that's still a form of cancer. Well, I'm hoping that this has helped you. Again, it's just a quick overview between non-threshold and threshold dose response relationships. And again, I hope this helps you. Thank you. Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.